Veronique.
And I'm Sylvia.
Welcome to the High Vibes and the Mind podcast,
where multicultural moms connect.
Hi everyone, we're back for a podcast on this nice Monday. This is Veronique. I'm with Sylvia. Today we have a guest and she's going to talk about something that's really important to us because we are in that age range where we are thinking about, menopause and being maybe in perimenopause, and we're not really sure, what the symptoms are. So we contacted Daina, and Daina is a holistic health coach. She specializes in supporting a perimenopausal woman in managing hormonal shifts. Her approach combines personalized nutrition, hormone balancing strategies, and stress reduction techniques to help women navigate the physical and emotional challenges of this stage of life. Daina empowers her clients to embrace their health journey and thrive through transitions with increased energy, clarity, and focus. Something we all need because I'm sure you ladies know about that fog in your brain after 40. And you forget everything. So Daina is like a health detective, identifying the root causes of hormone-related symptoms and crafting personalized wellness plans. By addressing hormonal imbalances, refining nutritional habits, and acknowledging the natural changes in women's health post-35 for lifelong wellness and resilience. So let's talk about all of this with Daina. Hi Daina, how are you today?
I'm good. How are you?
We're good. Thank you very much. So my first question for you would be, what are the symptoms of chronic fatigue syndrome?
Well, a major one is, like the name says, exhaustion, but bone crushing. It's not tired. You cannot move. It hurts to move. It hurts to wake up. It's hard to sleep. It's just, you feel really, crushed by fatigue. Just like you can't do anything. That's the big one. A lot of people struggle with aches and pains. I used to get weird muscle aches in my thighs. It wasn't joint pain. It wasn't due to exercise because I wasn't doing any. But it was just like this deep muscle ache that would happen when I got really tired. I remember having brain fog. We always associate being tired with a lot of brain fog. So I remember feeling like it was fighting to think clearly and just to get through a couple hours of school before I could go home and nap my day away. Those are my big ones. Some other people experience some viral symptoms like swollen glands and a sore throat or recurring sinus infections, bloating. Some digestive issues can show up as well. I did have some digestive issues where I would eat certain foods. It took me a while to figure out the pattern, but at the time I was like, I would eat something and within minutes I'd be writhing on the floor in so much pain, just like it's like my gut was twisting.
Oh, and God.
It would last for up to 6 hours. It would come in waves. Would come and just twist and hurt so bad and then go away, and then it would come again, and it would just usually was about 5 to 6 hours before I could move again. So back then we never associated it with my chronic fatigue, but now kind of what I know now and the digestive side of health and how everything is so interconnected, I do feel like that digestive problem for me was highly related to all the inflammation that I was dealing with.
So, and were you a teenager when that happened to you?
It started right after I got pneumonia, so I was 12.
Oh, so you were fairly young.
I was very young, yeah.
And you have chronic fatigue. So how common is that? Do you think, do you know if it's very common for kids to have it?
So
it sounds like an adult, issue.
It's highly related to mono. So generally, if a teenager is going to get it, it's generally around, 15, 16, 17. I did have mono at 15, and that's when I got the diagnosis. But the symptoms had started after pneumonia. So these stealth infections, it's related to an infection called Epstein-Barr virus. And so these stealth infections are in 90% of the population, but not all of us have an activation event that causes it. And so my activation was pneumonia, severe viral infection that activated my immune system and activated this infection. And so it can happen in kids. A lot of times it'll hit around 15, 16. But puberty is a big, major change in our lives as well. And that can be a time when the stealth infections or these really big hormonal shifts can activate these inflammatory issues in our body. So again, looking back, I'm like, it was a couple months after I hit puberty, and all kind of came at the same time. So.
And so your parents knew how to deal with this? I mean, at this time, did you just go to the doctor or have a stomach issue and take some Tylenol and you go on your way? Or?
Yeah, nobody knew how to deal with me. My parents, no judgment on their part, but I grew up on a farm in rural Manitoba, and basically we got up early, we did our chores, and we worked hard. And so I was called lazy a lot and kicked out of bed, like when I was trying to sleep, like, stop being so lazy, get up, do your chores. And so that they didn't know what to do with me. I ended up quitting everything I could except school. So all of my gymnastics, my skating, and my volleyball, all that stuff I had to quit.
Yeah, so, I can imagine, because there's no way you can exercise when you're in pain like this for 6 hours.
No.
It feels so frustrating too, because you want to have the energy to do things, but you just can't, like I've been there. When I remember one time, it was actually during COVID, that way I caught COVID, and one of the symptoms was extreme fatigue towards the end. And it was awful for like a whole week. I'm like, I want to get up, I want to do things, but all I wanted to do, my body just wanted to rest and sleep. So you feel like you're trapped in the body, right? So I can imagine like how tough that was, especially for a teenager in your early years. Wow. Is it related to any autoimmune disease as well, or there's no correlation?
So the Epstein-Barr virus itself is not, but the effects like chronic fatigue syndrome have an autoimmune component to it. It's like activating an autoimmune disease. So it does fall into that category. With Epstein-Barr, that can also activate hypothyroidism, POTS. I'm trying to think of some more, some adrenal issues. Like, there's various different problems in the body that Epstein-Barr itself can activate. Mine came and manifested as chronic fatigue. So yes, there is it turns into an autoimmune disorder for a lot of people.
Oh, I see. And does it affect, is it related also like to hormone imbalance, or it doesn't?
Yeah, there's a hormone component to it. It's when hormones change, like puberty, pregnancy, perimenopause, menopause for women, and particularly, there are some inflammatory events that happen at the same time. When our hormones are shifting, it can cause a lot of inflammation. It's stressful in the body, so inflammation is triggered. And when we activate that inflammation and our bodies are not primed to deal with an added amount of inflammation, that's when the immune system can like flip and attack itself, start attacking your own body, attack itself, activate more symptoms, and then we get sicker and have more symptoms. And
even like, imagine you're like in your 40s and you never had any issue like that before, and then all of a sudden you're like, what is that? Like, why is my digestive system messed up? Sometimes I wonder too, because I've been like feeling a lot of heartburn or like indigestion, and I'm like, what's that now? Like, do I have to deal with this? And it makes me wonder, if it's like something I've been eating, if it's inflammation. It's I guess like as your body's changing, like through those phases, right? Like anything can happen. So much fun.
Yes. Yeah, there's so much going on, especially for women that 35, 40, 45 age, just a lot changing.
And people don't talk about it as much, right? So that's so
No.
frustrating. Like even my friends, we don't talk about it. I'm like, hey, we are all in the same age group. How are you guys dealing with this? You know, nobody talks about it. So
no, nobody does.
yeah. So what are the symptoms of a hormonal imbalance? The main ones, you could say.
Ooh. So if we're talking about like reproductive hormones, so like perimenopause changes, some of the main ones that pop up are mood swings. All of a sudden you feel maybe a little bit more snappy, irritated easily. Anxiety can increase as well, and worry. We can struggle with sleep. Sleep's a big one. We suddenly become insomniacs, or we're waking up at 2 or 3 in the morning and can't get back to sleep. Fatigue hits, that brain fog increases, headaches, hot flashes, night sweats, bloating, gas, heartburn, skin problems. Maybe we get acne or rosacea, anything like that. Skin like dryness and itchiness, sagginess, saggy boobs is one.
Oh no.
Those body changes, your body starts to like, I had a friend describe it as like everything's just dropping.
Oh, that sounds so bad. Oh, yes.
There's a lot of symptoms that relate to hormonal imbalances, and yeah, it's confusing.
Wow, I can relate to a few, like most of them.
Is this so? Would you describe this like perimenopause? Because I was going to ask you, how do you know you are in perimenopause if you don't really have particular symptoms? Because I'm in my 50s but I'm not in menopause yet.
Right.
But I think I'm getting yet. I know I'm going to go. I'm going to get there yet soon. But I have something changed like for like maybe like a few years now. Before I get my period, I get a massive headache, like massive migraine, even a migraine. I can't do anything. I have to go lay down. And I never had that before. Never had that before. So I'm like, what is this? Is it because I'm getting old? So now I have headache when I have my period. So I don't even need a calendar. If I had that migraine, I know two days later or the following day, it's coming.
Yeah. As those hormones change, especially as progesterone is dropping, those headaches and migraines can start to kick in. So technically speaking, perimenopause is the 10 to 12 years before you officially go into menopause. Okay. So you can maybe, because we don't talk about it, like you said, Sylvia, if you kind of look back at, you're in your 50s now, menopause generally is about 55 to 58. That's might be when you go into menopause, like no longer have a period. But if you kind of look back and think, did anything else start to pop up 5 years ago? Did I notice any changes in my period or my weight or my focus or my sleep, anything like that? Those can all be indications that your hormones are shifting and you are in that perimenopausal phase of life.
Yeah. I mean, the sleep check, wake up at 2, 3 a.m., don't know why. The weight, of course, but I think that's also my fault. The change, the headache, and also the heavy menstruation also, which I never had before.
Yes. That's another changes in your period from like, it can go super heavy, it can go super light, it can go erratic, different days. Yeah.
Okay.
So,
but I'm like a clock though. I'm like a clock.
That's good.
When I know it's going to happen. So I'm like, I can still rely on this.
That's good.
And so when I'm going to get to menopause, I'm still, looking what I'm going to do. So what do you think about hormone replacement? Because I know you're more in a holistic, way. We're going to talk about that later. But what do you think about hormone replacement?
It's always your choice. I think that we can go through menopause without hormone replacement if we are prepared for it. And I think one of the things what we're not talking about with women is that you can use certain foods very easily to regulate your cycle and help alleviate the symptoms. Sometimes it doesn't work as effectively if we address it after the symptoms are really bad. But so like my plug here is the earlier you can start this, ladies, the better. But hormone replacement therapy can help alleviate some of the symptoms, but I do recommend supporting yourself nutritionally because hormone replacement therapy does come with its own risks. We're replacing estrogen primarily. Estrogen is more of our pro-cancer hormone in that phase of life. And there is the risk of uterine and ovarian and breast cancer with long-term hormone replacement therapy. And then some other issues with heart disease and inflammation and such too. So, I mean, everybody has their own choice. Do you, of course.
Yeah.
But I would love to see a woman work on her diet to support the hormones. It's around supporting your body and being able to produce what it can still, like progesterone and estrogen, as well as being able to eliminate or detoxify those hormones when we no longer need them. That's often the more of the problem with my clients is their body's not detoxing the hormones properly. So the old ones are circulating and causing a lot of these like heavy periods, hot flashes, headaches, etc.
I didn't know about the risk of cancer with hormone replacement, though. That's a good thing to know.
Yeah, it depends on the dosage and how long you take it for, but there is always a little bit of a risk with even the biosynthetic or bioavailable ones.
Okay.
So, like, since you're talking about the like holistic way or like better foods that we should be eating, what are some recommendations that you have for that, for like a better diet that we can try to improve the hormones and the right hormones?
Yeah. So what I tell my clients, what I tell my women is that we can't eat the same way we did in our 40s and 50s as we did in maybe our 20s and 30s. And one of the biggest shifts that's happening that we can't really stop is when estrogen drops, our ability or our cells' response to insulin reduces as well. So we become more insulin resistant. So you might notice more cravings for sugar or belly fat or back fat, like weight gain happening. And so we do have to shift away from eating sweets and starchier carbs, too much bread, too much cheese, too much of those foods that a lot of people love so much.
Yeah.
Everything I love. Cheese.
Yeah. And so that's one main thing. It's just kind of like minimizing the sweets and the sugar. Yeah.
But
cut them out entirely.
But do you think you have to eliminate or not? Like bread, for instance, if you want to have, is that okay to like eat the starchy food, or it's better if you just have eggs and, like for breakfast, for instance, instead of eating a toast together with a toast?
Yeah.
Yeah.
My work, like when I work with women, I really have like that energetic focus as well. Like I really want to help you have a lot of energy. So breakfast is one meal where we can do quite a bit of improvement. If you're like me, you grew up on like pancakes, cereal, toast, maybe bagels, muffins, stuff like that for breakfast.
Yeah.
And a lot of that's very high in sugar. All that stuff is very high in sugar. So if we can shift that to more eggs and like turkey bacon, more protein, more what else? Like healthy fats, like coconut milk and avocado and ground flax seeds and vegetables. More vegetables at breakfast is also ideal. That can really help stabilize the blood sugar first thing in the morning and then help prevent us from craving the carbs later on. Not to say you have to give up your bread forever, but minimizing it and kind of strategically moving your carbs around a little bit throughout the day just to support the blood sugar, especially at this time.
Yeah. Oh, God. It sucks.
So
we have to do all these changes.
Can you eat vegetable in the morning, Sylvia? Because I know you're better than me. I mean, you're good with food, but I always know where I'm going to eat something vegetable in the morning.
No, I mean, with avocados, I add avocado, like salsa. I think like salsa, Mexican salsa. Something like
salsa
that.
Salsa and eggs is good.
I didn't think about that. Okay.
Yeah.
Avocado, I like to have actually avocado with eggs and a piece of toast. I need my bread with the egg. I'm sorry. Yeah. One piece of toast, but like regular vegetables, no way.
Well, if you like smoothies, I love smoothies. One thing that I do is I'll buy zucchini, cauliflower, avocado, sometimes spinach, and especially the zucchini and the cauliflower. I can cut it up into little pieces and then freeze it and put it in the smoothie, and you don't taste it, but you're still getting vegetables. So yeah,
Or like
Okay.
on an omelette too, right? You
yeah,
can
yeah,
actually add
Yeah.
those vegetables.
yeah,
Yeah, that's one good
yeah,
way.
Yeah.
yeah. So any way you can think to hide them in your food, that
Yeah.
always works too.
Yeah, like kids, you have to hide
Yeah.
hide in
Yes.
your food.
Exactly.
Yeah,
Like kids.
yeah, yeah.
Now, talking about menopause and perimenopause and libido, change a little bit of the subject, even though like made me think, what are the good foods for libido? Because it
Libido.
kind of yeah, like like that desire for a little bit more action. I think like it
Yeah.
slows down a little bit. So yeah, how can we like? Is it like eating something different, maybe exercising more, or like what do we have to do to improve that?
A lot. So libido is more tied to testosterone levels, which can decrease as well. So foods like that are high in zinc, sardines, oysters, shrimp,
Oh, that's nice.
avocado
Ooh.
again. Yeah.
Interesting.
So zinc containing foods are really good for increasing your testosterone. And at the same time, we have this weird, like again, our body has this weird, we're reducing the production of testosterone, but our bodies are struggling to detoxify the old stuff. So then we want to support removing the old testosterone that can block the good stuff from doing its job. So that's where more like broccoli, cauliflower, kale, garlic and onions, and beets and apples and other fruits and lots of vegetables, really. Lots of produce. So,
Yeah,
just
and
to help
actually,
clear
it
that.
made me think about. I remember one time a gynecologist. At the time, I was trying to get pregnant, and I was asking for suggestions, like how to, like to help, like with get my body ready. And I remember she mentioned this hormonal, like a supplement. I think it was DEHA, something like that. But she's like, well, I've heard women are taking those supplements. And I was reading about it, and it seems like to give you energy, to give you all of like the things that you're talking about, like you feel like you lose weight quicker or whatever, like you have more energy. But then the side effects could be like facial hair and like some weird stuff. So I'm
Oh.
wondering if it has like the masculine hormone there, the testosterone, or have you heard of this
That is,
hormone? Or
yeah,
yeah,
DHEA is the
yeah.
precursor hormone to testosterone.
Oh, okay.
So when you increase it, you can increase the production of testosterone at the same time. So that can cause like facial hair where hair where you don't want it, hair loss where
Yeah.
you don't want it.
Mm-hmm. Do you think it's okay to take those supplements, or because I had mixed reviews about those things. I'm like, I don't know.
One thing about me is you'll never hear me say, especially with those ones, to just be like, oh yeah, it's okay to take them. I will only recommend supplements on a personalized level because some of them, like DHEA, there's the hormone regulating supplements that you can buy off of any shelf or off Amazon. They're really potent, and you can do a lot of damage and have a lot of bad side effects if you're not careful. And so without me knowing the person, I would say no. In general, I'd say stay away from them unless you're working with someone that really understands your body, your hormones, has that deep level understanding of how well your body's detoxifying those hormones, how well your body is able to use your hormones that are made and produce them as well. So
makes sense. Better not risk, It's a lot of like trendy supplements nowadays that can be dangerous.
Yeah, I had a really bad experience. I caught it pretty quick, but I had a hormone test done. It was the Dutch saliva test or the urine test. So I had a 4 points throughout the day. I had to pee on a little piece of paper and then send it away and get my my hormones tested. And it came back about 4 weeks later, the results that said my estrogen was too low. So when I saw my naturopathic doctor about 2-3 weeks after the results were in, she said, okay, we're going to give you this supplement to increase your estrogen. So I got the supplement a week later after that, started it 2 weeks in, I couldn't put my jeans on anymore. I'd suddenly just gained so much weight. So I stopped them and I emailed her and told her. And what we figured happened was that the time of the test, I had just finished a fairly potent detoxification protocol that she'd put me on. And so at the time, my liver was really strong and had probably pushing out excess estrogen a little bit faster than my body was creating it. But by the time I got the results and the time I got the supplement, things were back to normal. So all that supplement did was push me over the edge in the opposite direction. And then it took a really long time to lose that weight. It's hard.
Oh, no. Oh, my
so
goodness.
that's like, that's my experience with hormone regulating supplements, is like they can do a lot of damage, and it's very, be very, very careful with them. So I don't recommend doing that sort of thing on your own.
For sure.
Yeah. Trying to be healthy and you gain like more pound. No, thank you. I'm trying to lose weight.
No. There's this misconception that all supplements are just safe and easy and everybody can take them, but that's not exactly true.
Yes. Yeah. Some people don't even believe they works. Some people are like, that don't even go in your system or whatever. So sometimes I don't really know.
There's a lot to talk about with supplements too. I mean, if you have any type of digestive dysfunction, if you've got inflammation in the gut or low stomach acid, a lot of times your body's not even breaking down those supplements. So you're not getting the nutrients and it's just expensive urine at that point.
Interesting. Yeah. I didn't know about that.
Yeah.
So you were talking about smoothie earlier. That made me think about a long time ago. Yeah, a few years ago, I was doing a lot of juicing. What do you think about that? Because I know it's high in sugar because, it's the juice, but my skin was, Sylvia, my skin was glowing. I remember when I was doing that. And I was doing a lot of greens like kale, spinach, a lot of raspberry, stuff like that every night, I think. Every night I was doing some juicing. And after I stopped because it's too much work.
Yes. It's messy too.
Too much work and cleaning the machine and everything. So, but I did that for at least 6 months. I remember I have very good skin. But is it good for you to do that?
So, juicing, when you juice a vegetable or a fruit, you're removing the fiber. So that is what kind of slows down the digestion and breakdown of the glucose or the sugar. So yes, juices are very high in sugar because of that. They do have really great nutrients. And when you juice, you get a really high dose concentration of great nutrients. So you do look really good. And generally those nutrients are really good for your detoxification, your liver, your skin, your bladder and urinary tract. So yes, you do feel good. But if you were to juice, what I recommend, I definitely don't recommend anybody juice first thing in the morning because it can really spike insulin and worsen that insulin resistance. If you do have a juice, pair it with some protein or healthy fat just to slow down the absorption of the glucose and still get the nutrients from the juicing, just slows down that spike of sugar that can impact your pancreas and impact your blood sugar levels.
Okay.
So, yeah.
And also I was thinking, because I don't want to do that juicing anymore, but I still want to get, that beautiful skin. And I'm thinking of those cold pressed juice. There is no sugar added. Is that good? Is that the same thing that me doing the work?
Yeah, it's the same as you doing the work. Yeah, they do the work for you. Yeah.
Perfect.
Just still has, they do have sugar, just natural sugar, from the fruit or vegetables that's in it.
Okay.
Yeah.
And when we talked at the beginning, you were saying that you got all those symptoms when you were young. And so after you got diagnosed around 15, 16, right? You said?
Yes.
Later on. So is that what brought you to your now career, to work with other people, to be more holistic? Is it because I think something happened to you also, right? Something, you had a life-changing event that happened to you?
Yeah. So my chronic fatigue did kind of start me off on the investigating something to fix my fatigue. But it wasn't until I'll be honest, at about 12, I decided I did not want to have kids. And, everybody was like, you're going to change your mind. And so I tried to convince my doctors to have the surgery to prevent pregnancy. get my tubes tied. And they said I had to wait till I was 35. So the minute the week before I turned 35, I was like, okay, can I do this now? I want off birth control pills so bad. I don't like what I'm reading about them. I have so many risk factors, blah, blah, blah. So anyway, I dropped the birth control pills. And by the next cycle, when my period kind of came back normally, suddenly I broke out in cystic acne, like massive, like half-inch big spots everywhere. And it was not just my face, it was in my hair, it was in my neck, my chest, and my back, and my shoulders. And I was mortified. At that time, I was doing some burlesque dancing, and I quit all that because of like the tank tops and the outfits and stuff. I quit volleyball. I quit everything. I wanted to quit my job, but I still went in. I wore scarves and toques. I went grocery shopping at the time of day when I knew nobody would be there, just to avoid people. And I had to do something about it. And I did not want to go down the medical route. I had done the skin treatments and spot treatments and scrubs and facials and everything. Everything made it worse. So that was my very first dive into working with a naturopathic doctor. And I was a little nervous. I'm like, I don't know, people say it's a little woo. But anyway, I loved her. She gave me a very simple food protocol. And within 6 to 8 months, somewhere around there, my skin was 80% clear. And I was no longer wearing makeup. And I could do whatever I want. My hair was up. My neck was exposed. So I was back dancing. And at the same time, my energy started to rise a lot. I was happy. I was sleeping. So all these things that I didn't really realize were that big of a problem were suddenly gone. And so that's when I started looking. I'm like, this is fascinating. What else can I do with food to fix myself? So I found holistic nutrition. I went back and got certified in it. And within the certification program, there's all these protocols for adrenal fatigue and immunity and sluggish liver and poor digestion in every part of the body, but nothing on chronic fatigue syndrome. So I ended up pulling and playing with a bunch of different things. And that's finally completely put the chronic fatigue into remission through all that as well. So that's how I got into this. It all started with fatigue, and then it worked its way to hormones, went back to fatigue, and then now I'm back working with hormones again.
Okay. So that's how you work. You know, when you talk about the birth control, you got out of birth control and you had all those acne. It happened to me too.
Oh,
it was horrible.
It's awful.
I was taking the pill for maybe like 5 years. Then I broke up with my boyfriend. So I'm like, okay, I'm off the pill. I had all that acne from like when you were 15. I'm like, I thought I was done with this. It was all in my back, and it was like, I think I was scratching it, and it was like bleeding.
Yeah.
And I was working in a restaurant, all those pimples.
I know. Horrible. It is. It's mortifying.
It lasted maybe like 2 cycles, and after it went back kind of normal.
Oh,
but
that's
it just
good.
came out. Yeah, it just came out of nowhere. I'm like, what is it? So that's just my hormones coming back to normal, or?
Yeah. So this you coming off that hormonal birth control that has those hormones trying to suppress one and increase the other. And then for me, I never went away. I lasted about half a year, a bit longer before I'm like, okay, I need real help here. But yeah, my body was inflamed. I had a lot of sluggish detoxification. Like my liver was unhealthy. My digestion was a hot mess at the same time. All these things were happening. So yeah, my body was not healthy enough to take care of clearing all those hormones for me. So
was it the way you were eating also? Maybe because you were raised in a farm and.
Well, we didn't eat so bad on the farm, but when I moved out and went to university, I was on my own.
Fresh eggs.
When I moved out to university, I was on my own and I had very little money. And so I ate a lot of like ramen noodles and mac and cheese and grilled cheese sandwiches and tomato soup with milk. I ate a lot of dairy. And one thing I'm finding with my clients is that the ones that don't eat a lot of dairy don't have a lot of these symptoms in their 40s and 50s, because there's this link between estrogen and dairy. So I ate a lot of dairy, and I ate a lot of processed foods when I was in my 20s. So yeah, definitely diet.
We all did.
Yeah.
When you eat processed food, that's those nasty pizza.
Yes.
Noodles.
Every day, every meal.
Is there something maybe you want to add before we go? Because we're almost out of time. And I think I asked all my questions. Do you want to send maybe a message to our listeners about eating better, and if they have, chronic fatigue and that is curable?
And how they can work with you too, or you can
sure.
work with them.
Yeah.
Yeah.
Mm-hmm.
Yeah. So if you want to learn more about me, you can find me on Instagram. It's probably the best. It's at the.energized.woman. But I think the most important message I want women to hear, especially, is that your symptoms are real. You're not crazy. You deserve to be heard. And there are ways that we can work together to eliminate them for you. You're not supposed to feel horrible going through your 30s, 40s, 50s. You're supposed to feel great. And we've normalized this. It's perimenopause, or it's my period, or it's my hormones, to feel terrible. And it doesn't have to be that way. And if you are struggling with low energy, chronic fatigue, there's definitely something going on deep inside you that needs to be looked at and can be addressed. Food works ridiculously quickly once you get it right. So I highly recommend working with someone to find out what your body needs, because then we can figure out what diet to eat, how to make it fun, how to make it delicious, how to make it work for you. And then it's really motivating. But most of all, it's just, you get to see and feel the progress happening like week after week, because you're on the right track. And it's game changing. It's mind blowing. It's very, very cool.
I mean, yeah, you can feel the difference, right? When you eat. I mean, the few times I eat right and I'm okay for like a week and I exercise, right, the right way, yeah, I feel so much different.
Yeah, exactly.
After I get out of the wagon.
Yeah, but it's tough to get out of the comfort zone, right? Or like just doing whatever is easy. But that's when you feel like you achieve good results, when you just you have to you have to make the adjustments, right? With the food, maybe stop eating the things that you like. Like the same thing with me, I'm thinking about maybe I have to stop with the dairy, even though I love it. But the body is changing. So it's a good point to realize that we have to change the way we eat, and it's great to help women like that. So do you also manage, or you ask them to have a blood test or hormone test, or it's just mainly a diet plan that you give individualized?
Yeah, it's individuals. I have an assessment that I have every new client run through. It gives me a really, really thorough picture of where in their body they're struggling, where the imbalances are. It tells me what nutrients they're lacking or which ones we need to focus on. And then I have a hormone assessment that tells me which hormones are, whether you're high estrogen, low estrogen, etc. If you want to do a hormone test with your doctor, that's totally fine. The thing about the hormone tests is that they're a point in time. So like with me and my estrogen, you can get tested and then get it looked at maybe too late or at the wrong time. Getting the hormone tests at the right time of the month sometimes is important, and that gets missed. But also, hormone tests tell you how much circulating hormone you have. It doesn't tell you how well your body is using them, whether your cells are responding to the hormones properly, or whether you're properly clearing them and your detoxification pathways are clear and flowing and allowing everything. They don't. Another really important thing is if you're constipated in any way, this can really impact your hormones. It can cause those hormones that were detoxified to get reabsorbed and keep circulating. So, meaning the hormone test doesn't tell us if you're constipated.
No.
So it's a good, like, I feel like a hormone test is a nice starting point. If you're like, I don't know what's going on, I feel weird, things are off, please test my hormones. And then you can kind of get a starting point, but it's not the end all be all of what needs to happen next. Like, that's not like, okay, I see your estrogen's too low, here's a pill or a hormone replacement therapy. There's more below the surface that's causing your hormones to be out of whack, for lack of a better term.
Right.
Okay. Okay, so that's good information for us. I mean,
Yes.
I'm very happy to know that I'm in perimenopause and there's stuff I can do, changing my diet, and I can still do my juicing. So I'm happy about that.
Yeah.
I was feeling a bit guilty. I'm like, oh, is that too much sugar? But I never did it in the morning, so that's good.
Okay,
I always do it like lunch or dinner. So because I notice it makes me a little bit like, whew, in the morning is too much. I think it's too much sugar. Definitely.
Yes. Yes.
All right. Thank you, Dina. So
Thank you, Dina.
yeah, and good luck, with all the your future clients, and I hope our listener, are going to have a lot of questions about that, and they will contact you, or they can, reach you out on Instagram.
Awesome. Yes.
Yes.
This was fun. Thank you. Thank you so much.
Thanks, guys. Talk to you next time. Take care. Bye.
Thank you for tuning in to Hi Babs and a Mic. Until next time, keep learning, growing, and exploring. Don't forget to follow us on Instagram, Facebook, and YouTube.